Before we jump into today's episode, please remember this podcast is not therapy and it doesn't replace working with a qualified professional. While I aim to keep things grounded in science and offer a lot of educational insight, the content here should never be generalized. Everyone's experience is different. If you're experiencing any mental or medical distress, please reach out to a licensed provider who can support your specific needs. Welcome back to ADHD Realities. I'm your host, Dr. Leanne Borneman, clinical sexologist, ADHD relationship and sexuality expert. And this is the podcast we talk all things ADHD and sexuality in ways research is still lacking. So join me in today's episode and let's jump in. Today I have Dr. Justin Dubin, and I am really excited to get into all things male health and sexuality today. This is an area I am not an expertise in, so I'm very interested. Before I start all of my questions and where we're going to go in this conversation, can you just introduce yourself to everyone? Tell us a little bit more about who you are and how you've gotten to where you are today.
Thanks so much for having me on, Leanna. This is great. I'm really excited to talk on your platform here. My name is Justin Dubin. I'm a urologist who specializes in men's health, male infertility, sexual medicine, testosterone replacement therapy. A little bit about myself. I grew up in North Jersey, Wayne, New Jersey. I did my undergraduate degree at Johns Hopkins in Baltimore. I did my medical school back in New Jersey at Rutgers Robert Wood Johnson. And then I did urology residency at University of Miami in obviously Miami. And I wanted to super specialize and focus in men's health. So I ended up going to Northwestern in Chicago, where I spent an additional year of fellowship, learning what we call having an andrology fellowship, which is all those things that I mentioned before: men's health, male infertility, sexual medicine, low testosterone, erectile dysfunction. And what I really love about men's health and sexual health in general is this idea that sexual health is health. So what we know is that issues with your sexual health is often a warning sign of some other health issue currently going on or something coming down the pipeline. We typically say what's good for your heart is good for your parts. And that's true, because what we want, what I find is the challenge here, and we're going to discuss, of course, is this idea that there's a lot of stigmas. Guys don't want to talk about their health.
Yeah.
But if I can convince guys that they're going to have a better sex life if they start taking care of themselves today, I think I can motivate a lot of people to go see a doctor. The other thing is, a lot of the things I talk about is more quality of life metrics, right? People are living longer, but we want them to live better, more satisfying lives. And for a lot of people, that includes sexual health and their sexual health with themselves, with a partner. And I love this idea where medicine, a lot of people are thinking, don't die, don't die, don't die when they're talking to a doctor. We're trying to prevent you from dying. I'm trying to help you live, baby. I'm trying to help you live your best life. And oftentimes, in order to live that best life, you also have to do the things that will help you live a longer, better life overall.
Yeah, and I think like the first thing that I think of as you talk about all that is this idea of being reactive versus proactive in our health, and specifically male health and sexual health. So I'm just curious because I'll be honest, as a sex therapist myself, the concept of urology, I know I usually suggest my clients to go see a urologist when we're struggling with erectile dysfunction or some other concerns sexually. But I've never thought of it as, is urology also something that we could just be going to and seeing like someone like you? No, not me, but I mean, I guess yes, me too. But when we're talking about male health, to just be proactive? Like, do you see
Absolutely.
patients just to see patients where they're not coming in just for a quote conflict or problem?
So I think I do have that, and I have a good amount of guys who come in for what we call a wellness visit, just like you see your primary care doctor, but sometimes they want to focus on their health in the
Hmm.
sexual space. Some people want to get their testosterone checked, and they want to go to someone who knows what they're doing,
Yeah.
or someone who is younger, has family history of diabetes, or they have a history of fertility, or they're They want to have a child in the future. They're not there yet, but they want to understand their health now. So these are really good, important things. Now, it doesn't have to be a urologist to start, but I always recommend everyone see a primary care. And it's really sad because you bring up a really good point. Most guys are not going to any doctor. Less than 50% of men under the age of 40 are seeing a doctor on an annual
Wow.
basis. So this is something that we have an opportunity to change by finding new ways to motivate men to get into the office. I can't tell you how many times guys have come into me to see me and their erections are they come in for erectile dysfunction. I say, hey, listen, you're when was the last time you went to see a doctor? And they're like, oh, I'm healthy. Like, any medical problems? No, I'm healthy. He's 50 pounds overweight. His blood pressure's through the roof. He looks like he got diabetes. I go, when was the last time you went to the doctor? And he goes, yeah, about 25 years ago. So yeah, obviously you don't have a health problem
Yeah.
because you've never gone to the doctor. And now I just
Yeah.
diagnose you with diabetes, high blood pressure, high cholesterol, and I'm sending
Yeah.
you to a primary care doctor. If we get in earlier, we can get you set for success earlier as well.
And I think that also just then drives into this concept because I see it too, even in like my intake forms, I can see the resistance from my male clients versus my female clients, where like the males just are like not applicable or like, okay, or no, like very short answer because there is still a lot of stigma, a lot of shame attached to this idea of needing to go to the doctor. So I think that is a perfect place for us to start if we haven't already started here.
Yeah,
But like when we think of this shame, um can I start with the male infertility piece first?
of
Because
course.
I feel like that for me specifically too, as the clinician, I work with a lot of people trying to conceive, and I see that the weight is generally always on the female. And that's a part that I have to, guide and educate. But here I have you in front of me today, and I would love you to educate me and everyone on why is it important for us to also be focusing on the male when it comes to infertility and the steps and the measures and all of that?
I think it is such an important point that you bring up. There is an insanely unfair stigma and burden on the female partner when it comes to couples struggling with fertility or fertility in general. And when you look at the statistics, right, couples infertility is defined by not being able to achieve a pregnancy after engaging in unprotected sex for a year.
Hmm.
About 15%, one in seven, one in six couples struggle with it. It's quite common. Uh, of those couples, however, believe it or not, 50% of the time, there is a male factor involved. 30% of the time, it is strictly a male factor causing this fertility issue within the couple. And yet, most men are not going to see a doctor for it. They're not getting evaluated for their fertility. It is the female partner who's unfairly getting all the workups, which are way more invasive. It's very easy to come see me and do a male fertility workup. I think it's much easier and quicker than the female workup. But I think part of it is this stigma that when guys, it's everything. It's their erections, their testosterone, their fertility. It's all the same. Where we grow up, we have this picture of masculinity and what we want to be. We want to be strong, healthy, good in bed with a good hard erection. We want to be able to have children and provide for a family. Now, when any of these things go wrong, this picture that you have of yourself is broken and you are probably a little bit embarrassed. You feel maybe less of a man. And the truth is, you're not less of a man. You just are having an issue that can be resolved. But the biggest problem here is we can't help men unless they come in to let us help them, and we have to see them.
Yeah, no, and I think that's a really good point is that piece of what we're taught growing up and men being taught to be a certain person, image, identity, and that I also see it all the time that men aren't given the space to share their emotions, express their emotions because of this idea of needing to be the quote strong one in the room. And for whatever
Mhm.
reason, strong means not having emotions, which is like who made that up? But you're right, I see it all the time. And I'm curious because when I think about infertility, right, like, and it being more placed on the female side of things, when people are going to doctors, are doctors actually saying, hey, listen, guy, go see a urologist, go do this? Or is there a barrier here as well where we're not seeing enough people in these spaces suggesting the men, the males, to go seek support as well?
It's a great question. And I think it's a combination of a little bit of everything. Unfortunately, there's not many male infertility doctors out there, right? I mean, I'm in South Florida right now practicing. Fortunately, there's three of us, which still is not a lot. But
Yeah.
there's places in the country where there's zero. And there's places where you just don't have access to them. So that because of that, people don't know to ask or they don't know where to go. But I also think, we know there's a couple studies out there that the gatekeepers to the fertility doctors for men is actually the female fertility doctors, right? They are the main referral base for someone. Now, that doesn't mean that the guys go, right?
Hmm.
And that's the other thing. I can tell you, I work very closely with a lot of IVF centers, and a lot of the times they don't want to come, and you can make a referral, and yet they don't come. There was a great study that came out of my alma mater, Northwestern, where they surveyed men and they asked them if they were concerned about their fertility. And if they were concerned about their fertility, were they willing to go talk to a doctor? And only 30% of these men who were concerned about fertility issues were willing to go see a doctor. So
Wow.
that's really all you need to hear to
Yeah.
understand this overwhelming stigma or fear of going to the doctor to address these issues. So it is a combination of both, right? You can take a horse to water, but you can't make them drink, kind of thing.
Yeah. Yeah. Yeah.
But if
And
we can show that your fertility is a window into your overall health, which it is, right? We can hopefully motivate men to come get their fertility checkup so we can check their overall health so that they can live longer, more satisfying lives.
all right, you hear that, men? Men, listen up. Not shameful at all. Like, this is proactive. This is important. You deserve it, right? Like, that's what I'm hearing. I'm loving the vibe right now because, like, what you're talking about is that people are given this information. You're told, hey, listen, there could be a problem here. And the shame attached to what you're supposed to be. And if you're not being that thing, you're failing is stronger than the motive to go and do the thing that could just be helping all along. Wow. Like, that to me is like, crazy, but I understand it. I understand how heavy shame is. I mean, as an ADHDer, fuck, I carry shame. I'm still unlearning my shame, right? But so here's my question then, right? Where we're talking about male infertility, what are some of the common causes or the leading causes associated with male infertility? Because I got to be honest, I don't know any of them really, other than low sperm count and maybe weight. That's it.
Right. So I would say it's really important that we understand this. So I did mention already that your fertility is a good marker for your overall health. So things that can compromise your sperm count, lifestyle, we're talking about, sedentary lifestyle, being causing obesity, being overweight,
Mm-hmm.
having low testosterone because you have metabolic syndrome or because you have diabetes. All of these things can lower your testosterone, can lower your sperm count because testosterone is important for sperm. On the other end, you have this idea, believe it or not, taking testosterone kills your sperm. And that's one of the more I'm in South Florida. That's one of the most common things that I see in my office is young men who are on testosterone replacement therapy who were not told of the implications that
Mm.
taking testosterone can kill your sperm. And people are like, you just told me that you need testosterone to have good sperm. So if I want to improve my testosterone, why would that kill my sperm? And it's almost counterintuitive until you understand how the medication works, right? When you take testosterone, it signals to your brain that you're making enough testosterone. So your brain stops the signals to your testicles to make testosterone and to make
Mm.
sperm. So they actually atrophy, they can get smaller, and they
Wow.
stop making sperm. There's data showing that only after about, I think 4 months, about 60% of men on testosterone replacement therapy have zero sperm in their ejaculate. Now, you can recover, right? The data shows stopping it, putting you on, there's other medications that I put men on, things like Clomid or HCG, that can actually increase your testosterone naturally and also preserve, if not improve, your fertility. But when you stop testosterone, about 90% of guys have return of sperm to their ejaculate in the first year. So there is a good marker here, but it's not always as good as it was before. And so because of that, I never recommend anyone who is interested in future fertility to take testosterone replacement therapy until you're 100% done having kids. So that's another one. One thing I think lifestyle that a lot of guys don't know is hot tubs, saunas, steam rooms, jacuzzis. They kill your sperm. While they may be good for your health in other aspects, the one thing it is not good is for your fertility health. Your testicles are outside your body for a reason. They like to be a couple degrees cooler than the rest of your body because that's the ideal temperature for sperm to develop. So when you go into a hot tub, a sauna, a steam room, jacuzzi, you are cooking those boys and you're killing your sperm temporarily. Now, a sperm cycle is 3 months. We're very different than women, where women, they're born with the amount of eggs they
Yeah.
have, and those are the eggs that
Uh-huh.
they have. We are continuously creating sperm.
You
The
little
sperm cycle
fuckers.
is about. We got it good, I guess, but so 3 months. 3 months is you can
Okay.
so it's important when I counsel anyone for fertility. If you're doing something that is compromising your fertility, we won't see results for at least 3 months. Or if you're doing something to improve your fertility, it's another 3 months. You don't want to just be like, oh, we did a semen analysis. I stopped drinking, smoking,
That's
vaping,
interesting. Yeah.
marijuana. All these things can also compromise your fertility. Like, oh, I stopped vaping 2 weeks ago. Let's repeat it. That's not how it works. You got to wait a few months. There's
Wow.
an anatomical things. There's something called a varicocele. It's varicose vein of your testicle. They're very common. They're in about 15% of men. Most live their whole lives and don't even know they had it. I did have a varicocele, but I had surgery not for fertility purposes. They can also cause testicle pain in a small portion of patients. So there's a lot of things, and there's also unfortunately genetics. Some people have things we just can't identify, where they just don't make sperm. They're completely normal in every other way, but they don't make sperm, or they just don't make it well. And, we just don't have the technology to genetically test every single thing. But there are things we test for. We test for like Klinefelter syndrome. There's
Hmm.
Y microdeletions. There's stuff like that.
So wait. Now here's my question, right? So let's say, because again, I work with a lot of clients that are in their process of trying to conceive, going through IVF, all of these things. And when I think of the IVF process, when I hear my male clients say, like, my sperm's fine, everything was tested, you just threw out some of these other things. And I can't remember the word you used, something with a V. It was the vein thing.
Varicocele,
Yeah.
varicocele.
Are people like, how do you know about, like, how does somebody know that this possibly is a thing? And in our IVF place, and obviously you don't know what every IVF place is doing and what every doctor is doing, but is it like a common understanding that could also be causing a concern?
It's a very common understanding amongst
Okay.
everyone on the male and female side of the fertility journey.
Okay.
Um, the female fertility doctor is obviously not checking for the male partner. That's not their patient. But they send them to me to do an evaluation. And I think it's important guys understand what this evaluation is, because it is really not anything. Okay. So when I come into my office, I care about four things. Okay. One, I want to get a history of you, like your lifestyle, things that can compromise your fertility.
Hmm.
And I want to get a history of your partner. Their age is very important. Are they having a regular menstrual cycle? Are they have you guys ever achieved a pregnancy before? Things like this, right? Two, I want to do a physical exam. I want to check your testicles. I want to check your anatomy. I want to make sure you don't have varicoceles. And if you do, we can consider addressing it if it's indicated. Just because you have them doesn't mean you need to do anything with them.
Okay.
Three, I like to get blood work. We already addressed hormone levels. I would do a full hormone panel, including testosterone, FSH, LH, a whole bunch of other things, estrogen. And then number four is the gold standard of semen analysis, right? Because all that other stuff doesn't matter as long as, if everything else is normal. So that's the four things. And guess what? we have the technology now. You don't have to ejaculate in my office. In fact, I don't let that happen, right? We have at-home kits you purchase at home, or you purchase in my office, or you can purchase online. They ship them to your house. You do it from the comfort of your house and you ship it out.
That's
And you
awesome.
and it's so easy. And I think and I also encourage men, even if they're scared to go see the doctor, if you're interested in your fertility status, you can go buy one of these kits. I can't tell you how many men are starting to come see me, not because their doctor referred them, because they tried a kit, they were interested in their fertility, and wanted to learn more about it.
That's
And
awesome.
I think it's such an easy, good barrier to entry for men who can have a test, a very good, accurate test. There are certain ones that are better than others. I think I recommend Fellow is a wonderful company. Fellow. But that you can get really good information on your fertility status. And, if you're someone, our old guidelines are used to say, like, wait a year if you can't achieve a pregnancy to test your semen analysis. But if you're interested, why not? I say I welcome everyone to learn more about their health, and I think that has shifted in the last few years. I want people to be active about their health. I want them to understand their bodies, and I want them to understand if they need to make a difference or make a change.
Yeah.
Then I'm here for them to do that.
That's freaking awesome. I'm so intrigued, and I can't. This isn't all about infertility, so I'm definitely needing to also talk about testosterone because I know that that is all part of it as well. But like, I could talk to you for like hour on male.
I could
You
do
are
it
just like
all.
a
I
plethora
could
of
do it.
information. I'm like, my nerd side is just jamming right now. So like, I'm gonna now go shift to the next topic
Wait,
because
I do want to say one other thing, just
yeah,
one
go for
final
it.
conclusion on this. Because when we're talking about these stigmas, the thing I tell all these partners, and I think it's really important too, is you have to understand that if a guy has low sperm count, a lot of times it's not their fault. It's nothing you can do. But it's the only disease process that can think of, or that I know of, where if the female partner is completely normal, they are the ones who have to go through the treatment, right? So you have to realize that I have a low sperm count. We can't conceive naturally. Guess what? My wife is going through IVF where she's getting stuck. All I have to do is still ejaculate into a cup. So it can create stresses, and this is where things like where you're important and you play an important role in these things, right? There can be issues because of this. And I always tell my patients, my male patients, I say, your best ability is availability. You better be there for her. You need to be going to the appointments. You need to be supporting her, and you need to be there, because a lot of the times it's no one's fault, but obviously, they get the short end of the stick when it comes to the fertility journey sometimes.
Yeah, and I will add to that as well, because what I've noticed with a lot of the clients I've worked with is that those husbands, the males that are part of the process and are there, they hold this level of guilt or shame associated with like, I failed, or I'm going to take something away from my wife or my partner, and I it's that in itself creates even further stress. And people don't realize that even though you're showing up and you're trying to be there for them, when you're carrying that unrealistic responsibility as if you truly are the thing that was going to be able to just make or break, you're creating a level of like distress that you're not even seeing, but oh boy, is it there.
Oh yeah.
Yeah, and I always tell my clients, this isn't a start to finish. You're navigating this. It's a navigation. And with all navigations, you don't know where the hell you're going. And that's the unfortunate truth of it too. I would assume you experience the same thing. I mean, I'm sure tons of people come in and there's this goal of I want to be able to do this, but sometimes that isn't obtainable. So it's always really important to be mindful of the process as well, right?
Yeah,
Like,
it's so important, because there's people who I cannot guarantee they will be a biological father, right?
yeah.
I can guarantee the mother, if they want to use donor sperm or something like that, they can. But there are surgeries that I do for people who have zero sperm, and every time the data shows they have a 50% chance.
Okay.
50% chance I find sperm, 50% chance I don't. It's a great day or it's the worst day, right?
Yeah.
I'm telling someone that there's a death, or I'm telling them that there's going to be life. And there's no in between. It's a very extreme, feeling, especially for like they're going through it, but I also have to go through that and counsel them. But I think it's important that no matter what, before I do that surgery, I tell them two things. One, if I can't find the sperm, there's no sperm in there, because I'm going to give it everything I've got in my
Yeah.
physical body to do that. And two, if you want to be a father, if you want to be a parent, you're going to be a parent. I've seen enough at this end of the game where,
Hmm.
you know, it doesn't work out favorably, but at some point you have that kid. When that kid is in your hands, that's your kid. And
Yeah.
I think that's very hard for some people to understand until they go through the process and they understand how it feels.
Yeah.
But yeah, it's a navigation process. The journey is not always guaranteed to be the way that you want. But at the end of the day, as long as you're doing everything you physically can, I mean, it's in a mentally, physically, emotionally, financially difficult situation for a
Yeah.
lot of people
A lot of
and
pressure, a lot of
a
stress.
lot of things
Yeah.
going on. And so just know too, you're not alone and you will get an outcome that you want. If it's wanting to be a parent, you'll be a parent no matter what.
Yeah. Yeah, no, and I agree with that wholeheartedly, and it's a process. Now I don't my impulsivity and where I'm still on now testosterone. I'm just a jumper.
Do it.
Because I think even today's age, we're still learning and unlearning a lot when it comes to this topic of testosterone. Even for us females, we're learning a lot more about it, how it affects us and our anatomy and our experiences. It's definitely a hot topic for sure. Can you do me a solid favor and give me some of the, I don't even know how, if you're able to do this, but like the facts versus the myths, if you can come up with the, when I say facts versus myths, like what are the typical things that you see coming in working with people or even on social media that people are getting wrong about testosterone in terms of the experience in as a man in men's health?
Yeah, so I think we have to start with the social media stuff because I think it's really important to understand. So several years ago, we're all online. We are all
Hmm.
chronically online now. But I kept seeing such bad information on Instagram and TikTok that we ended up doing a study where we evaluated 6 men's health topics: testosterone, uh, infertility, vasectomy, Peyronie's disease. Um, uh, and semen retention, and there was another one.
Hmm.
And we just looked at all the information. We found the top posts, went through the 50 top posts. We categorized it. We saw if it was accurate. We saw who was talking, identified all of it. And what we found overwhelmingly was that for all these topics, consistently, completely inaccurate. It's not given by professionals. It's not given by health professionals. It is, given by, people usually pushing some kind of product, pushing some kind of idea or business. And, with a lack of providers, healthcare providers, I think less than about 10% of the content was made by physicians. You are in a place where you're getting bad, inaccurate information. And at best, you're getting information, that, you're just reading and you're believing and you're
Yeah.
feeling a certain way. At worst, you are trying to use that information and you're either purchasing a product that's wasting your money, your time, and also potentially being harmful. What do you know, right? You don't know what the
Hmm.
actual risks are. And then you're also delaying your care for something to see someone that you actually need. So it's very hard when you go online to not get caught up in all of it. But what you have to understand is that you need to ask yourself several questions. One, what am I looking for? What am I trying to learn? What is my outcome, right? Am I trying to like just learn about a disease state, learn more about my health? Am I trying to change something? And like, if two, what am I trying to change? Am I interested in buying a product? Am I trying to just, do a lifestyle thing? And three, who is telling me this stuff? Like, what is their background? Is it some 19-year-old dick swinging TikToker who says that yanking your penis is going to make it bigger? Unfortunately, there are a lot of those on there. It's not true. Don't listen to these people. Are they a provider? And then four is like, just because they're a provider, ask, are they pushing something? Like, do they want a product? Are they giving me
You
are
are
they selling me a
hitting
product?
such
Are they
good
doing all
points
these
right
things?
now. Yes.
So like, because I've seen it all.
Yeah.
And this is, and listen, I lost my mind going through that study. Like I was going crazy on
I
reading
can
all this stuff.
imagine.
And so these are all the important questions, right? Because if you can't answer any of like those questions, or if you say it out loud and you're like, why the hell am I buying from this guy who says this is what your doctor doesn't want you to know? Or like, this is going to take pharmacy, this is going to kill all the pharmacies. Like, this worked for me. These are all huge red flags in the
Hmm.
space of you should not be doing this. I see all the time now, you have cortisol face. It's some 21-year-old guy on TikTok saying you have cortisol face. Buy these supplements. What the hell
Just
is,
say, what the fuck? It's
what the
okay.
fuck? What the fuck are you talking about, dude?
Yes.
No one buy this shit. It's all
Yes.
bullshit. So yeah, that's my stance on all that. Sorry, but I
And
don't know if you
no,
want to
no,
comment
and
on
what
that.
you're talking about too, and this is where like my frustration comes in. You're asking people to be critical thinkers. That's what you're doing. And I think that's the problem. We've gotten so sucked into the easy way of navigating information around our health, our sexuality, and we're not actively really critically thinking. And I think those 4 point questions that you just outlined are great spaces for people to start really reframing, reflecting, like, what is going on here, right? So I share that frustration. And I see it in the ADHD community all the time. And the amount of content I've been blocked from because I'm a caller outer. I like to make waves, not friends on
Good for
this
you.
realm of the spectrum. I feel it in this realm. So I can only imagine how hard it was for you reading, doing that study. That's horrible because it's like men in general already have shame associated with a variety of things. We don't need to add more broken promises to it. It's this idea of like, this is how we fix it, or this is what you need to do. And it's taking you further and further away from the real routes that could actually be helping and supporting you.
Now I'm a little bit older. I was around when, we had MapQuest and like where we
Me
just
too.
before had MapQuest and all that stuff.
I'm
So I used
37
to
this
call this,
summer.
yeah, I used to call this the directions problem, but I actually now call it the IKEA problem, where men, when it goes to our health, it's this idea how we go to IKEA. We buy a thing, we buy a piece of furniture, say it's a chair. I'm not reading the instructions. I'm going to try and figure out. I'm going to build this stupid chair by myself. I'm just going to figure it out. It's going to take me 3 times as long. I'm going to finish it. The leg is going to be a little bit wonky. And then I'm going to finally go back, read the instructions, and I'm going to get it done right away. And that's what men are trying to do with their health. They're doing it with the directions, right? They'd rather drive around for 2 more hours instead of asking someone for directions on how to get there, where it would have taken 10 minutes. And that's what men are doing for their health because they don't want to go talk to anyone. So they go online, they purchase all this crap that they see. And then ironically, because it's so stigmatized, they don't tell anyone because they're too embarrassed to tell someone that they
Yeah.
bought something for whatever the problem sexually may be or fertility. So it's just this loophole. And eventually they come see me, hopefully, where we could have treated this, saved you time, saved you money, saved anxiety about all these things, and
Mhm.
hopefully it fixed your problem faster.
Yeah, I'm similar in that boat. I'm usually the fifth or sixth stop for a lot of my clients. I'm never really the first. And so here's okay. So maybe this is a more better packaged question because when I think of testosterone, also I think of the low T, the lower testosterone experiences. What are the typical signs and symptoms for men? Like, is there things that we can find on Google? And then there is those other things that someone like yourself is able to provide us more insight in just to better understand those symptoms and signs. So if indeed maybe someone's experiencing this, maybe that's now this moment of maybe now I should reach out.
Yeah, so I think we have to understand low testosterone is quite common now, and you're hearing all these
Really?
things on media saying like, "Oh, every man's testosterone is declining, fertility is declining," and I think there is some truth to that. There's some good data
Yeah.
on that. Now, why? Well, there's data showing about 20% of guys under the age of 40 through 60 have low testosterone, 30% in their 70s, like 50% in their 80s. There used to be this concept of andropause, just like menopause, where it's like, oh, you hit 50, your fertility, your testosterone
Interesting.
starts to decline. It's actually not really true. It's not your age that causes a decline in testosterone as you get older. Now, it is more likely as you get older, but it's because you're acquiring other health issues, right? High blood pressure, diabetes, obesity,
Mm.
or just to name a few, HIV, cancer treatments. These are all things that can lower your testosterone as you get older, or just lower your testosterone in general. And so we've never been more, sedentary as a society. We've never eaten more processed crap than as a
Mm-hmm.
society. So it's not surprising that we're starting to see some kind of decline where we have high diabetes, high obesity rates, and that's part of it. Now, going to your question, what are the signs and symptoms of low testosterone? Most of them can be actually pretty general. Low energy, erectile dysfunction, uh, you know, weight gain, breast development, loss of body or facial hair. But the most specific or sensitive one that is the strongest indicator of having low testosterone is low sex drive, low libido. That is a very strong indicator of having low testosterone. But if you're having any of those issues, you should go talk at least to your primary care to get a baseline testosterone or see a urologist to get evaluated. But yeah, I think libido and erectile dysfunction, any guy who comes into my office who has erectile dysfunction, I'm getting a testosterone level 100%. There's
Okay.
no reason not to. So that's kind of what we're looking at. Now, how do we naturally improve testosterone levels? I don't know if that was the next question, or you tell me. I'm sorry.
No, no, I think that's actually a good guided area you're going into because I know that there's all these myths and conceptions around like how us females are, supposed to help our desires, etc., and anatomy. So I would love to know if there's fact or fiction associated with the natural ways to help testosterone for men.
So there are good ways to improve your testosterone level. So one is really losing weight. And how do you do that? Well, we know that if you lose about 15% of your body weight, if you're obese, I think you get an increase in about 250 points potentially of your testosterone. That's a huge jump,
Wow.
right?
Now, can I
So
ask you really quickly? And I'm
yeah,
I'm going to be interruptive here for a second because I think when you had said that it's not age that affects the levels per se, it's that other health variables are pulling the need and the intention in your system, right,
correct.
to navigate. So when we think of weight, and I think this is what people don't think of, and I talk a lot about this with my clients, and this is why I wanted to say something. When you are overweight, I've lost about 60 pounds now, and when I tell you the energy differences and where I'm navigating, it's because when you are overweight, you are definitely putting more strain on your body, and that's taking energy. And I'm assuming that's exactly what you're talking about here and why you get that increase coming back for you because your body can finally reserve the space to do so.
Yeah. And there's also like other physiological things, right? So if you have a lot of fat, fat some has some enzymes that convert testosterone to estrogen. So it does
Interesting.
actually decrease your testosterone levels having more fat.
Wow.
So
Okay.
there is a role in all of this. And so how do you increase your testosterone levels naturally? Well, eating healthy, decrease processed foods, more fruits, more vegetables, you know, uh, grass fed, organic, fruit, Mediterranean diet's really the most well studied, and it's a great diet if you're interested in to help you lose weight. Number two is exercise. If we're busy, people are busy. I know
Yeah.
you don't have enough time to do cardio and to do weightlifting. If you have to choose, I'm telling you to choose resistance training. It doesn't have to be heavy lifting, but
Yeah.
resistance training is better for your testosterone levels, is better for losing weight, it's better for your bone health, your muscle health. So if you have to choose, go resistance training. Number three, you have to get good sleep. Actually, sleep health is really, really important. And as we are getting more knowledge on sleep. Sleep is becoming probably one of the most underappreciated, most important things in terms for everything, right? Our
Yeah.
physical health, our mental health, but things like sleep apnea, if you have it, it puts you at risk for low testosterone because our
Interesting.
testosterone regenerates when we sleep. So if we have less sleep, we can lose testosterone every day, right? If I'm
Right.
sleeping 4 hours, I guarantee you my testosterone is going to be lower from the day I slept eight. That's another thing. Four is decrease stress, which I don't know. I can't really help you with. Maybe you can help them with that. But I always say go talk to someone. Obviously, talk to a
Yeah.
therapist. If you need a psychiatrist or talk to someone, I think that can obviously do that, develop healthy other habits. I took up meditation. It's been very good for me. I really enjoy it. And then, the other one is a newer concept is reduction of exposure to endocrine disrupting chemicals and microplastics. So there's really becoming a strong amount of data showing that these endocrine disrupting chemicals, microplastics in, plastic bottles, plastic containers, in shampoos, in
Wow.
dishwashing detergent can all potentially impact our hormone levels and our fertility. So I've personally taken it seriously. I only use glass in my house now. I got rid of all plastics. I don't microwave plastic. I microwave everything in glass. I changed my shampoos. I changed my deodorant. I changed my detergent. Now, is this like the most essential thing? No, I think I'm micro
Mhm.
picking here, but these are things to think about, right? Because how we live our lives right now, we set ourselves up for success now and success in the future.
Mhm. And as you were saying that about glass bottles, I was like, "That must sound nice. You must not have children."
Yeah, correct. Exactly, exactly.
'Cause I'm
But there
looking at
are like
myself.
silicone, I believe, is safe, right? Like there
Okay.
are like there are endocrine disrupting, chemical free, microplastic free
Yeah.
other products. But yeah, you're right. I
Yeah,
don't.
no. But it's fair, and I think it's being proactive because I know even on I took a class when I was doing my sex therapy certification on hormones, and indeed like the smells, like the Glade plugins and things like that. The research doesn't show it's a one size fits all, but our bodies may indeed react negatively to those things, which then it can affect our hormones. So it's like, err on the side of caution kind of mentality. So, hey, if you can do it and you can swing it, and it's just an extra possible variable for you to strengthen your ability to not have negative effects, why not? Right. But also
Absolutely.
don't beat yourself up if you can't do everything and anything either. Something is better than nothing.
Right. Baby steps.
Yeah.
Everything. Rome wasn't built in a day. Like, I'm not
100%.
telling you should go eat a Mediterranean diet right now, do nothing else, and then just, lift 7 days a week. You're not going to do it. That's not realistic. Like, that's not how people work, right? You
Uh-huh.
have to create habits that work for you. And however that is, if you start going to the gym once a week, or if you start walking, you know, twice a week, I live in Florida. There's no reason you can't walk. It's beautiful out every day. It's great. So, like, go for a walk, go with a friend, go walk your dog, do
Mhm.
something, just get moving.
Yeah, fair. Now, I did not actually pre-warn you about this, but you brought it up. So now I'm going to bring it up because I actually also teach human sexuality, and I bring this topic up because I always found it fascinating. Peyronie's disease.
Hmm.
And because when you landed that word, I was like, I wonder if anyone else picked that up, what that is. Can you do me a solid? And can we get into just a little bit on what it is? Because I know that there is a lot of men. Well, I don't know if there's a lot of men, but I'm gonna let you start. What is it? And then I'll dive dig.
So perfect. So Peyronie's disease is where you, as a man, develop a plaque or a deformity on your penis. And it can cause a curvature of your penis, it can cause hinging, and it can cause shortening of your penis. It's actually, the data says I think it's about 10 to 12% of men have it. We all know that it's definitely higher. I would say almost like 15 to 20% of men probably
Wow.
have it because
Okay.
this is incredibly, incredibly embarrassing for guys to talk about, right? They have a curve in their penis. They hate how it looks. It can be painful and it can also be painful for the partner, right? Because if it's not going in the direction that you want,
Mhm.
that's not good either. So, it can make sex difficult and you're losing your length. So it's something that's very stigmatized and it's hard for guys to come in and talk about. The way that I describe it though, because I think people don't really get how it's working. It's like, what are you talking about? If you think of about a balloon when you're at a kid's party where they can make into toy animals, just without making it into the toy animal, if you blow up that balloon and it looks like a penis, that there's a layer of that balloon is the layer of your penis called the tunica albuginea. Now, we don't know why this happens. Sometimes it is a trauma. You can fracture your penis or micro traumas to your penis. Sometimes you have a genetics thing. Sometimes it's just bad luck or a combination of everything. That
Interesting.
that layer develops a plaque or a scar, right? And so it's like taking a piece of duct tape and slapping it on that balloon piece. So when you expand the balloon, when you're getting an erection, that duct tape is not allowing that area of the balloon to extend. So it shortens and then it curves in the direction of that scar. Does that make sense? Do you
It
have
does,
that
and I'm never gonna
visualization?
look at a balloon animal the same way ever again. You've just ingrained that. Now it's interesting too because like you're also talking about the shame piece, right? I've worked with several men who've experienced the hook, if you will, and it's not the porn dick. Like that's the problem, right? Like we, all of us, growing up, if I have yet to meet somebody that hasn't used porn as our education on what our bodies are supposed to look like. And the penis is definitely the big area of shame, comparison. And I know the hook idea, aka Peyronie's. Although, let me ask you, is all hooked penises, and I don't even know if I'm using the right terminology here, is that Peyronie's? Or
No, so you can have a what we call a congenital curvature. Most guys have a small amount of curve, and but
interesting.
and so you can be born with a curvature, but you can also develop a curvature. And if you're born with it, that's not Peyronie's. It's only Peyronie's if you develop it. Now, some guys come in, they go, listen, this is better, man. It's going in the direction. My wife loves it. I'm not going to do anything. But most of the time, that's not the case. But yeah, you're right. Like, it's just one of those things where you look at other people's penises on porn, and first off, you should never compare yourself to anyone on porn because these are professionals. They do what they do for a living for a reason. They're
Hmm.
like incredible athletes for the most
Entertainment.
part,
Yeah. Yeah.
right? But yeah, you're right. Like I think that if it bothers you, you need to go talk to someone about it because we have things we can do to treat it, and there's a lot of different options based off of what you're going through.
Yeah. And the one of the reasons I brought it up is because when you brought it up, I was like, oh, this is a great opportunity for anyone listening to understand if you're that person that you had a straight dick one day and you were doing something with your partner and it went and then it hurt. And then all of a sudden, next thing you know, next couple of times you got erect, it was a little painful. And maybe the pain went away, but now you got a curve and you're like, what the hell is going on? Peronies.
Facts,
And,
all
and,
facts.
and then now you know where to go if you need and want to go, and it's totally okay.
It's
And your
very
dick
okay.
is
It's
not
welcome.
broken.
It's not broken. We
It's
can fix
not
it.
broken. I love it. Now, here's my next go to. Again, did not warn you about this, but I'm flowing here. Are you comfortable to give us a little bit more insight on this concept of penis size and penis pumps?
Yeah, so a couple things about penis size. Very, very interesting, right? The on average, the erect penis is about 5.1 to 5.5 inches hard. And a micro penis is real. It's usually said to be less than about 3.5 inches hard. So that's unfortunate. We can't make your penis bigger. We can only make it harder through surgery. So if you are someone who unfortunately is not happy with their size, guess what? Sex isn't just penetrative. I'm sure you tell that to all of your client, your patients.
Mm-hmm.
And so, you better be good at doing some other stuff. And that's okay, right?
Yeah.
People have massive penises and that's not necessarily good either. So there was a really interesting study asking what is the ideal penis size, right? So really
Mm-hmm.
cool study done several years ago. It's one of the smartest studies I've ever seen. What they did is they went to online places like Amazon and they just looked at the top selling dildo sizes and vibrator sizes to see what the most common decided size was.
Yeah.
And it's around 5.5 inches. So the
That's
average is the
interesting.
average for a reason. So, it's pretty amazing. So having the biggest penis, having the smallest penis, it doesn't really matter. It's really how you use it and how you're aware of your partner, right? We also know most women are not achieving, I think only about 20% of women achieve orgasm through
Yep.
penetrative intercourse alone. So
Mm-hmm.
we need to be guys doing other stuff. And sex, you have to think literally and figuratively in punny way, you have to think outside the box, right? In order to get your woman off.
Look at you, pun and all. Now, let me ask you, in males, right? Like, let's talk about not heterosexual relationships. And you don't have to be in a gay relationship to like anal, by the way. I just need to
Mhm.
preface that because the anus is not have a sexual orientation by any means whatsoever. But let's say we're talking about a gay couple. Does penis size matter in general when we're just talking about anal across the board?
That's a good question. I don't know the answer to.
Fair. That's
I
fine.
actually
I
do
threw
not
that
know
at
the
you.
answer. I will tell you a lot of gay men value their ejaculation much more than straight men.
Cool.
That's just, from my experiences. So, if you're a guy and you like to see the money shot and you're having things like prostate problems, like urinary issues, there's certain medications that can cause your ejaculate volume to decrease, or there's prostate procedures to help you pee better that can compromise your ejaculation function. So if that's something that's important to you, I'm
Yeah.
just bringing this up. You should make sure you're bringing it up to your urologist, because there are options that we call ejaculatory sparing medications, ejaculatory sparing procedures as well.
Awesome. So here's my next question for you. This goes back to the penis size. Do you know who determined the micro penis size of 3.5
Yeah,
inches?
because
That's
it's
very
two standard
interesting.
it's two standard deviations.
Okay.
So you use statistics as two standard deviations below the average. So,
Wow.
you have now I'm not a statistician or a math guy anymore, but I think one standard deviation is about 65% of the population, either way, and then two is about 98%. So you're the bottom like 1% on it, and
Okay.
that's where you get that. There's also shower versus grower. That's an actual thing. They did a great study at where was that, Tulane or UC Irvine. Basically, I think it was Tulane. They basically identified that if you are grow more than 2 centimeters, you are a grower. If you don't, you're a shower. I think most people are growers. I think the data said like 75% are growers.
It's so interesting to me how everyone comes up with these terminologies and we have to find terminologies for these experiences. Now it's
You gotta
interesting.
have fun. Gotta
I
have
know.
fun
Well,
talking
yes.
about
I mean, hey,
penises.
I'm one of those that I love a name for everything. But it's just when you really start talking about it in these spaces, you start to like, wow, we really do. We've come very far with just naming everything. Now, so can I ask? Because this goes back to the social media thing. When I brought up penis pumps, right? I've heard a variety of different things about penis pumps. Now, I've looked at the research. From what I have been able to find, there is no study out there, no research out there that has been able to say, yes, penis pumps help size. I have not been able to find one. However, I might be wrong. I might be wrong. And I hear a lot of people talking about the benefits of it. Do you have experience through this topic? Because I think that's
Yes.
a really important thing to get some clarification
I
on.
think it's a really important topic that is not discussed enough. So when we're talking about penis pumps, we're talking about vacuum erection devices, right? So
Mm-hmm.
these are devices you put on your penis, you push a button or you pump it up and it sucks the air out of it, drawing blood into your penis, getting you hard. Now, in terms of making your penis bigger, the answer is it cannot, but it can help restore your penis if you had lost length, right? So there's certain situations where you can lose some length, right? As you get older, your penis can atrophy. You don't use it, you lose it. It's actually true. So if you're not being sexually active, you can actually lose your some length. But we talked about Peyronie's disease, right? You
Mm-hmm.
can shorten and lose length. If you have prostate surgery, if you have a prostatectomy for prostate cancer, you can also lose some length. So vacuum erection devices are helpful for restoring the length that you had. They're not going to make you bigger than you ever were, but they can potentially restore to where you were. They can also play a role in erectile dysfunction, but I want you to comment first. You said it.
Because I think what you just brought up is what I've heard in the background. What you're talking about then is the restoring of the tissue, right?
No, it's
What are we
stretching the tissue. I'm
the
not making
stretching the
new tissue.
tissue?
It's
Okay.
not making new
Okay.
tissue. No, no.
Okay.
This is not regenerative medicine. There's
This
very
is
few
so
things.
interesting.
Yeah, regenerative medicine. There's a very few things. There's a couple things one thing that the data is suggesting works is shockwave therapy to your penis to help for mild to moderate erectile dysfunction to
Okay.
regenerate vessels and nerves into your penis, but it's not for everyone. You have to be the right candidate. But for vacuum erection devices, it is just bringing that tissue back. It's stretching it. It's not like actually,
Wow.
it's not like because it's contracted, it's atrophied, and it's unatrophying it in many ways, or it's stretching that plaque out. So it's restoring your previous length. It's not going to make you bigger, for sure. And you can use it. It's a great tool for erectile dysfunction because what I didn't mention is if you're using it for erectile dysfunction, you have the pump on, you You suck off, you push the button so the air comes off, comes out of the device, blood goes into your penis. And oftentimes you can take a cock ring. I always recommend or a constriction band is
Yeah,
what the
yeah, yeah.
medical terminology is. You slide it onto the base of your penis with the vacuum on, and you slide it on so it traps the blood, and then you can get a
Oh, that's
fuller,
so
harder
cool.
erection. I don't recommend you keep it on for more than 20 minutes. I also don't think you should have any metal ones, any hard plastic, or anything like that because it can get stuck. And I've sawed these things off of people in the ER, so I'd rather not that be
Really?
you. Yeah.
All
Um,
right.
but they're really good. If you want to take it, you can use them with Viagra, you can use it with Cialis, you can use it by itself, you can use it with injections, you can use it with a penile implant, you can do it with
Mhm.
everything. A vacuum erection device is a cool, good add-on to anyone who just wants to explore getting a harder or more satisfying erection.
That's really awesome. And I would be doing people a disservice if I didn't ask the last question or topic, erectile dysfunction, because I, again, have not reached out to the literature as of yet with this, but I have noticed I'm seeing a lot more younger men experiencing erectile dysfunction than I've heard about. Like, just, you generally growing up, you hear it. It's an old person thing. When you get old, your dick stops working, kind of thing. But I've actually been working with a lot of young men. What about you? Can you talk a little bit more about the myths, the experience, everything and anything, wherever the wind takes you?
Yeah, I think this is a really important topic as well because I think there has been an increase in erectile dysfunction in the younger men. So we've seen, you know, I would say 30 to 40% of men under the age of 40 have erectile dysfunction now. 50% in their 50s, 60 in their 60s, 70 in their 70s, 80s in their 80s is kind of the data, how prevalent it is. Erectile dysfunction is the most common sexual dysfunction disorder in men. Statistically speaking, we've all had erectile dysfunction. It's the inability to maintain or get an erection for the desired amount of time, right? If it's a one off, great. It can be a one off. But if it's consistent, it's a problem and you should go talk to someone. Now, I think it's important in order to understand like why maybe younger people are doing this. Well, first off, we did a study. We surveyed men under the age of 40, asked them whether they had used erectile dysfunction medications in the past, and then we gave them a survey to see if they met criteria for erectile dysfunction. About 46% had used erectile dysfunction medications under the age of 40, and over like 50% of them met criteria for erectile
Wow.
dysfunction, which is higher than the original numbers that I gave you. So it is concerning, but in order to get a good erection, you need five things. If any of these things go wrong, you can have erectile dysfunction. And one, you need good blood flow to your penis. So what can compromise that? Vaping, smoking, heart disease, right? Diabetes can compromise your blood flow. These are all things that are a problem, right? We call the erectile dysfunction the canary in the coal mine. It is an early sign for a heart attack or stroke 5, 10 years earlier than it would be. So you're at higher risk for having a heart attack or stroke, specifically more heart attack, having a history of erectile dysfunction. So you should always be talking to your primary care. Two, you need good nerves. What can compromise that? Diabetes is the big one, right? People don't think diabetes. They think about their hands, their feet, their eyes. But guess what? The nerves in your penis, I don't care how big your penis are much, much smaller than
Mm,
those anywhere else. And oftentimes, the erectile dysfunction is the first sign of poorly controlled or long-term diabetics that they have.
wow.
Uh, Three is you need good testosterone levels. We already discussed some of those things, obesity and all that. Four is you need to be aroused. And this is something that sounds funny, but this is where a lot of people like you come in and it's important.
Mhm.
I'm always asking my partner, my patient, hey, everything good at home? Are you having a good relationship with your partner? A lot of times they're like, oh, we're having an argument where I'm just really not feeling them right now. There's something going. So I send them to sex therapists like
Yeah.
yourself.
Hmm.
And then five is you need to be in a good state of mind. Stress, anxiety, depression. Unfortunately, the medications that treat those things also can cause erectile dysfunction as well.
Yeah.
So when you put all of these things together, why are young men having more risk of erectile dysfunction? Well, I do think that there is an increased stress component. We know that during COVID, PDE5s like Viagra, Cialis had a significant increase in usage. And we all know that was like a start point for a lot of people struggling with mental health. And I think that a
Yeah.
lot of us haven't really recovered completely, not from COVID specifically, but the anxiety and the stresses that, changed us. And I think that that can be, passed down how we live our lives and how we
Mm-hmm.
interact with other people. And so I think that there's a component there for sure. I think that when we talk about things like fertility, I see a lot of erectile dysfunction in guys who are trying for fertility because
Yeah.
they're young, and it's stressful. It takes the fun out of sex for a lot of people. And then also, I already said, we're less healthy as a society in general. And
Yeah.
when we combine all these things, it's not surprising that we're seeing younger men with erectile dysfunction.
Yeah, and I think to piggyback off of that, just from the mental health perspective, something that I see generally as the biggest concern associated with that is the pressure of performance via orgasm, right? It's this the sex is the goal of orgasm, and that creates so much freaking pressure. It's insane. So when I have these men coming in their 20s and their 30s, I always joke about it in this respect. And this is probably horrible to say, but I don't freaking care. I'm my own little person here. I say it's good thing you're in now because one day your dick may not work when you get older, and now you'll know all the tools and all the options you can have to navigate it then.
No, I think that's true. I think you're absolutely right. And we have to really get guys from thinking about just penetration is sex, right? There's
Yeah.
just so much other things that you need to do to satisfy your partner in order to have a good, happy sex life. And I think that people ask me about porn. Is porn one of those problems? I don't really think so. There's not good data
Yep.
suggesting that porn causes erectile dysfunction. It's a great tool, as you know, for
Mhm.
education.
Yeah.
And listen, I think too much of anything though, I think like is not great. But if you're masturbating all day and you're not able to perform because you jerked off 3 times, like it's probably because you jerked off three
Mhm.
times. And I do think that there is this pathway you can create, right? You can get deep into fetishism, as you know, where like you can't recreate some of these things in real life. And if that's the only way you're getting off, then that's something you can work with a sex therapist, talk about with your partner,
Mhm.
right? My good friend who's a sex therapist down here, Dr. Lisa Paz, she always says, like, when it comes to porn, you want to diversify your portfolio, right?
Yeah.
So, and I think it's a great way of looking at it. She's like, you like ass, go look at a little bit of ass here. You like tits, go look at a little
Mhm.
tits. Like if you want to like, look at something that looks similar to your partner so you can kind of feel like it's kind of getting into the mood with that. And then be communicative, right?
Yeah.
Communicate with your partner, communicate what you like, what you don't like, so that you can get to where you want to be. And I think, wrapping this all up is the idea that men we struggle with is communication. We don't communicate our issues to our doctors. We don't
Mhm.
communicate our issues to our friends, our family, our partners. And in order to do all of the things that we've talked about to live a better, happier life, better sex life, longer life, you need to be communicating your health and your concerns with a doctor, with your partner, and whoever else, if it needs to be your family member, for support.
Yeah, and basically what you're saying is we need to learn to feel our feels, peeps. Feel the feels. You have been just an amazing space of information and conversation. I'm so happy you were on, and I hope everyone listening today has maybe chipped away a little bit at the shame, and you maybe feel now excited to go see a urologist or your doctor or somebody to give you the attention you deserve. So, how do people find you? Because you are freaking kick ass awesome.
Thank you. I appreciate it. This was really fun. So I'm in South Florida. You can Google Dr. Justin Dubin. I'm practicing down here. Also, I have a men's health podcast called Man Up, a doctor's guide to men's health, all on all podcasting platforms, Spotify, iTunes, YouTube. Subscribe, download, give us a review. Always appreciate that. So that's where you can find me. It's at the Man Up Pod. I'm at Justin Dubin MD on all socials. Those are all
Awesome. And
unanimous.
I'll put all that in the description for everyone below. Thank you so much. I actually am going to go tell my husband all the things. I'm excited. I love it. Thank you so much for being here today. And you're just freaking awesome. Follow, follow,
Thanks.
follow him. He is great. Love it. Thank you again.
Thank you so much. This is great.
Thanks so much for joining me for today's episode. And if you enjoyed what you heard or something really resonated with you, it would mean the world if you subscribed, shared it with a friend, or left a review. That's how we keep these conversations going and growing. And until next time, take care of yourself and keep showing up in ways that matter to you, but more importantly, work with your brain and not against it.